Hello, fellow learners. My name is Shavonda Franklin, attending Nightingale, BSN 246, Group 15. Today I will be performing the skills of inserting an IV and discharging the IV. Before going into the patient room, I have washed my hand and gathered my supplies. The supplies I will be using today to perform my IV insertion will be the IV insertion kit, my IV extension set, a 20 gauge needle, which is perfect for my patient, and I also have a normal saline flush. I will make sure that all of my equipment is placed onto a sterile surface. I will now begin my procedure. My first step in my procedure will be putting on my gloves. By putting on my gloves, I want to make sure that my gloves are intact and sterile. The next step would be taking my IV extension set and my normal saline flush. I will begin by flushing my line to make sure there is no air bubbles in my line. Next, I will place my line with the flush connected back onto my sterile surface. Next, I will take my IV starter kit and open up the package. I would then remove my tourniquet. I would take my tourniquet, place it onto my patient's arm 4 to 6 inches proximal above the site. So my site is distal 6 inches. Excuse me, my site is distal. It's distal to the proximal site, which is 4 to 6 inches from the proximal site. I will then palpate for a vein. After finding my vein, I will now sterilize my insertion site. I will grab my iodine swab, break it, clean my site in circular motion, starting from the inside, moving outward. I would then take my 20 gauge needle, I want to make sure my needle is intact. My needle's intact. Before inserting my IV inside of the patient, I want to make sure it's intact and has no loose edges. I will then take my site, place my finger, my non-dominant finger, on the IV site, verify the vein in which I will puncture, take my needle in my dominant hand, insert the IV to the site. Okay. I will draw my IV back 0.6 centimeters. Okay. I've received blood coming out of my port. I will then take my non-dominant hand, remove my needle, check to make sure that the needle have came out intact. There's no loose edges to avoid leaving any sharps inside of the patient vein that will potentially cause an embolism. I will now retract my needle and place it inside of the sharps container. After placing the needle inside of the patient, I will now remove the tourniquet. After removing the tourniquet, I will take my IV line that's connected to my normal saline, connect it while still holding the IV in place with the non-dominant hand, making sure to not to connect the connector port. I will then flush my IV. Before flushing my IV, I will retract the needle to receive drawback. After receiving drawback, I will then proceed to flush my site. Now that I know that my IV is in place, I will then take my Tegaderm, still holding my IV part in place with my non-dominant hand. I would then take my Tegaderm and place it onto the IV site, making sure to not cover the connector part. Placing my Tegaderm in place, I will now remove the excess parts of the dressing. Making sure to put any waste inside of the waste basket. I will make sure my IV is still in place. The Tegaderm is not covering the connected part. I will then place my label on the side of the Tegaderm, not covering the part, the port, the insertion connector part. I will then disconnect. I will not disconnect. I will then disconnect my flush. Before disconnecting my flush, I will make sure the interlock is closed. Disconnecting the flush from the IV tubing. I will then loop my IV upward to avoid the IV site becoming occluded. I will then take my already prepared tape to secure my line. After connecting and stabilizing my IV, I will then discharge any waste that's at the bedside into the trash and DC my sharps inside of my sharps container. Remove my gloves, perform hand hygiene. My next step after performing hand hygiene is to document inside of the patient's chart. Now, my next step is to remove the IV. I have verified my physician order to remove the IV. I have informed the patient of the physician order to move the IV. Before removing the patient IV, I will verify that I have all the necessary equipment in order to remove the patient IV. I have washed my hands and will now put on my gloves. While putting on my gloves, I want to make sure that my gloves are intact. Okay. I will start by removing the IV by removing the tape used to secure the loop of the IV. I will then take gauze with my non-dominant hand. With my dominant hand, I will take the dressing, take the gauze, and place it over the IV site. Making sure to not touch the IV site with my gloves, or to not let anything touch the IV site. I will keep the gauze on the IV site. I will then, with my dominant hand, remove the IV. After removing the patient's IV, I will check to verify that the IV has came out intact and making sure there is no blood clot connected to my IV. I will then take the IV, discharge it, while still having my hand covered with gauze on the insertion site for at least 30 minutes, compressing the site. For 30 seconds, I will be compressing the IV site. Next, I will take a piece of tape while still holding the IV site in which I have just de-seed my IV. I'm going to take a piece of medical tape, place it over the site with the gauze still in place. I will then throw out anything that needs to be thrown away into the waste basket, sharps inside the sharp container. I will then remove my gloves, trash them, and perform hand hygiene. Now that I have discontinued my patient's IV, I will now go inside of the medical records and chart that I have de-seed my patient's IV. Thank you for watching my IV insertion and IV discontinued video. Thank you.